Hey everyone, it's Elias here, and I had top surgery a little over a month ago. I had top surgery with Dr. Tuchler in Irvine in Orange County, California through Kaiser. I had a double incision without nipple grafts, and you'll see what I mean. I'll explain it and show you what that looks like in a little bit here. But first I wanted to talk about how it's been the last month in recovery. So I was advised right away that I had no restrictions in terms of moving my arms or anything like that. But to be honest, that made me a little bit nervous knowing that a lot of people have been advised to not use their arms too much, just in the case of unnecessary scarring or anything like that. So I was kind of in the mix of that. I was doing some things by myself, using my arms to some extent, but definitely not like putting it over my head or anything, even though I had the clear to do whatever as long as I wasn't carrying over 10 pounds. So the first 24 hours I felt really good, and that's just because the local anesthesia basically made it so that it was painless. But after that, some pain started to kick in, and it wasn't necessarily at the site, but I have chronic pain, so that was kicking in, and a lot of that has to do with past binding that wasn't so safe, I guess you could say. I haven't binded in like 3.5 years, but it has had some lasting damage. So to anyone out there who is binding or is thinking of binding, just make sure that you're doing it safely and you're wearing the correct size. Always look at the size guides. So I was actually told at my 1-week post-op that I needed to wear my vest for 6 weeks. But then when I went to my 2-week post-op, I saw someone else and they said that I could just wear it for 2 weeks. So at that point, I didn't have to wear it anymore after that visit. So that was really confusing, but luckily I only had to wear it for 2 weeks because the vest was horrible. I remember after every meal, I would just get bigger and bigger, and that would make things extremely tight. And to be honest, I didn't have a bowel movement for more than 5 days. So that was just horrible. I decided that I was going to cut out dairy and any added sugars and try to limit even natural sugars, just to bring down any inflammation, to try and help myself be more mobile and limit the chronic pain. I was sleeping in a recliner for like 3 weeks or so, just because I couldn't sleep on my back, because then it would be super hard to get up in the mornings. I did that for maybe 3 to 4-ish weeks, and then after that I've been sleeping on my back, and I've been fine getting up. Some things I still can't do, like obviously I can't lift anything that's super heavy. For me personally, I can't use the microwave, so I can't prepare my own food because my microwave happens to be really high, and I'm only like 5'2". So before surgery, I could barely reach it. Now, obviously, that's really difficult, so I just don't want to risk anything. So something I did experience that I wasn't expecting, I didn't really know about, and I hadn't really heard much about, was post-op depression. I felt this wave of sadness, and I knew I wasn't regretting the procedure, but for some reason it was just this feeling that I wasn't shaking off in the beginning. I looked at some forums, and I've come to the conclusion that it's probably just because I've gotten out of my daily routine, not having control over what I'm doing every day. I'm a pretty busy person, and I choose to be busy, and I can get pretty anxious when I'm not. There was some big changes just because, my surgery took place the day after I finished my semester. So going into summer, I've already experienced I tend to get depression over school breaks. So with the added plus of literally not being able to do anything because of my recovery, made things really difficult for me. Not being able to make things orderly and organized the way that I usually do, because I'm under someone else's care. I think also there's a bit of grief I was having. I felt this way throughout my transition, so it wasn't really a surprise, but I kind of realized that I kind of felt a little bit of grief in the sense that, yes, I'm so lucky, I'm so privileged to be able to have this kind of procedure and to have people around me that support me, but at the same time, I felt grief because when I have to go through these medical interventions in order to just feel okay with myself, it's not like a typical thing that the majority of people have to go through. So I think there is some grief there. So yeah, I wish my care team would have spoke about it, but even aside from that, I feel like it's just not really published that much in the literature to begin with, in research, and I think there's a lot more that needs to go into just starting the conversation and then go into the actual research of why it happens and what it might look like. Okay, so now I'm going to reveal my chest. So yeah, I'm pretty flat, but I'll stand up so you can see it better. So I didn't have any like paper tape or anything after recovery. They used glue to seal off the actual incisions. The glue is still there. That's why that's why it looks so dark. That's not what the scar is gonna look like. That's just the pen marking, the blue pen marking that was sealed in by the glue. It is finally starting to come off. They say that this tape should come off within like 2 to 3 weeks, maybe even 4, but it's practically still there all the way across. Kind of coming off on the ends, but just barely. So if you can see, like, that pink spot is a little bit more representative of what my actual scar looks like. I didn't shower for the first week, and then for another 1 to 2 weeks after that, I was facing reverse so that the water is hitting my back. My nipples, like I said, I didn't have nipple grafts, so they weren't touched. The incisions occurred below and a little farther down as well. So there was no incision that took place above. The nipples have actually retracted a bit. If you look at my top surgery vlog, you can see my pre-op, my 1 week and my 2 week post-op. And since then, they've retracted quite a bit. Something that did happen is that this nipple, don't know if you can see that, but it actually went inverted. So if I pull here, you might be able to see that it is going inwards. This one hasn't, but what did happen with this one is that the lower half under the nipple has kind of folded over. So that's interesting. I don't mind this one, how it's doing, but this one, it's not exactly what I want, but if this is what it's gonna look like, I don't think I would be too mad about it. But I'm gonna see my surgeon for the first time since the surgery's actually taken place in about a little over a week, so definitely bring it up to his attention and see what solutions he might have. But yeah, so it's starting to kind of come out now because of the temperature, but when it's completely soft, it's completely inwards. This is what it looks like. Yeah, we decided to go with a little bit of round incisions just to make it look a little bit more natural, a little bit more similar to, you know, cis male's chest perhaps. And then it comes pretty close into the middle, but it doesn't touch. And from the side. So yeah, that's my chest. Overall, I'm pretty happy with it. There are some few things that I guess I would like to ask about, but overall, I'm really happy with the results. Thank you for watching. If you haven't already seen the top surgery vlog, you can see basically my day of going through it, my reveal, when I first took off my vest, as well as some photos. So thank you for watching. If you aren't already subscribed, please subscribe and like and comment this video if you liked it. If you resonated with anything that I said, or if you have any questions, please let me know down below. Thank you.